Hey, good morning, Jay. How are you doing?
I am fantastic, Natalie.
I am too. You know what? I am so excited that we have another Heroes Caring for Heroes special educational podcast. And
I am as well.
I know. And this has been so much fun because I've learned so much because, I'm a civilian. I don't know if you know that, Jay.
I do.
Yeah.
And
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 so
you're a
I had
decent
one.
civilian.
Well, fairly decent. And so, but the reality is, we're not here to talk about us like we always do.
True.
We are here to educate folks on Wounded Warrior Project, and
That's
they are
exactly
near
right.
and dear. We have had several of our guests from the series talk about how wonderful they are to work with. And I would love for you to introduce our guest representative.
I would love to. And I'm so excited that Jonathan Pruden is here with us today because I have seen advertisements for Wounded Warriors and I really did not know all that Wounded Warriors did. So I'm excited to have him here. So, again, today we have Jonathan Pruden with us today. He is with the Wounded Warrior Project. He is a special advisor to the Chief of Staff for Warrior Care. He is a warrior himself. He was on the initial invasion of Iraq with the 3rd Infantry Division, and he was one of the first improvised explosive device, the IED casualties of Operation Iraqi Freedom. Jonathan, we are so happy that you are here with us today.
We are
And
privileged to have you.
that is exactly right. And we're excited to hear more about Wounded Warriors, how they are helping caregivers, but also how we as civilians can help Wounded Warriors.
Yeah. Well, thank you guys for having me. I appreciate the work you do, highlighting the amazing work of caregivers. I can't say enough about my firsthand experience. My wife was my full-time caregiver after I was wounded, and I wouldn't be where I am today without her. That's a certain thing, and I think that's true for a lot of our warriors. So thank you for the work that you do. My focus for the past 15 years has been veterans and active duty service members, but I'm on the board of the Center for Independent Living down here as well. And that's a broad spectrum, folks with disabilities across the community. And in most cases, they have caregivers and loved ones providing those services and that love and support. So appreciate what you guys do.
Thank you. Well, Jonathan, start out and tell our audience, tell us a little bit about history of Wounded Warriors and just a history of you guys.
Sure. Wounded Warrior Project was started in 2003 by a guy named John Melia, who was actually a Marine that was in a helicopter crash off of Somalia. And he remembered his recovery and some of his buddies' recovery, and he saw all the wounded coming off the battlefield from the invasion of Iraq in '03, and he said, we've got to do better. As you know, when you leave a theater, your clothes are cut off of you, you show up back stateside with nothing but a hospital gown on, and he started just with backpacks, packing backpacks with essential items, clothing, CD players, calling cards back in the day, right?
Yeah.
And those were important touches of home and little thank yous, but that grew into a whole number of services, almost 20 programs and services that we provide today
Wow.
to our warriors and their caregivers. And it's not just from the point of injury. We do have teams in Germany. We have international teams that are touch points at Landstuhl Regional Medical Center, and then at Walter Reed and at the polytrauma centers in the States. So we're meeting them at bedside still, as we started doing. And then the majority of our veterans today they're veterans, right? They're not active duty. We don't thankfully have the number of casualties coming back from the battlefields week in and week out that we did for the last 20 years. And so our focus has shifted somewhat to the veteran population and some of the long-term care needs that these veterans have, especially our brain injured patients and those with chronic diseases and with cancers. So the azimuth has shifted slightly, but the focus is always care for the warriors and families and a holistic package of programs and services to complement and augment what VA and DoD are able to provide. We can't supplant that, right? We're not a healthcare network. We don't have billions of dollars to spend on healthcare, but we are able to sometimes do stopgap measures to bridge the gap between VA and DoD care, or to get somebody into care tonight who needs to be in care tonight. We can't get an authorization until next week. And so we have a whole pile of programs, our complex case coordination program, our independence program, our benefits program, and I won't give you the whole list right now, but they all have a role in the journey of the caregiver from that point of injury all the way through to return to normal, whatever that new normal looks like.
Mm-hmm.
And that's for the warrior and the caregiver.
So it sounds like it's interesting because I didn't know as much about it. I just knew you did great things. And a lot of things that I think people may know about Wounded Warriors where you take people out. So like Pam and my guests are connected to Wounded Warrior, their son, they're a guest confessor this year in this year's series. And their son, Jason, was also injured in an IED explosion 17 years ago. He was 19 years old. And so, but Jason's gone out with Wounded Warrior and he's gone out to Colorado and done experiential stuff. And they talk about the impact in their confession. They talked about the impact, that positive impact on his, because he's a TBI as well, that on his brain activity, how the physicians say when he goes out and does activities that you all offer, that he comes back and he's actually, they see improvement in brain functioning, which is like, and I'm sure that, you all were, you said, hey, we started out point of contact. We just wanted them to feel appreciated and valued and supported with a backpack. And you all are really making great change. That's got to feel really good.
Well, I'm glad you mentioned that couple. They're one of my favorite people, and they're again, but they're emblematic of somebody who was wounded and is going to have lifelong needs for support, and also, frankly, of a couple who's done an incredible job of providing the care for him, but also using us and other outside resources to help empower him and make him feel less like a patient who can't do anything, but also that he can do things on his own and he can be empowered. And that's our mission statement is to honor and empower, right? Honoring is the thank you for your service, the backpack, the nice trips, those things. Empowerment is giving both the warriors and the caregivers the tools to live their lives, whatever right looks like for them, right? Whatever they can accomplish. I mean, we've got folks that are in persistent vegetative states, and they're probably not going to ever wake up. That's the reality. That's the harsh reality. And we provide support for their caregivers to help them with that journey. We have folks more like myself. I, lost a leg and was in a wheelchair for about 3 years and had 20 operations at 7 different hospitals. And Amy was absolutely my full-time caregiver in those first years. And all that entails, right? And eventually I was blessed because she had a psych degree and was smart. She started to say, okay, it's time for you to take care of yourself, and started pushing me towards greater independence. And when I dropped my clothes beside the couch, she'd say, you can put them in the hamper, right? Little things like that.
I already know we like Amy. I need Amy to come talk to Jason.
but the recognizing, where in that journey it was time to help and do for me when I really couldn't do for myself. And then when it was time to push me and empower me. And we try to foster that and support that through our programs and services. Our independence program, we have community support specialists who actually go out to the veterans' homes and provide whatever support they need. In other words, what do you want to do? What can you do with your limitations? Do you want to do music therapy? Do you want to go to a community garden and plant gardens? Do you want to volunteer at Habitat for Humanity? Whatever it is, they facilitate that. And it also gives the caregivers a little bit of respite and a little bit of time.
Absolutely.
So I love that piece of our independence program. It does everything from, nurse case management type of services to more intensive things, but the community support specialists are great for giving respite and time. And so it's not always you and your spouse or the mom or the dad or whoever the caregiver is 24/7. There's somebody else. You have another outlet. You have another person to speak to, whatever your capabilities are. So it's a wonderful program.
You all have, and I don't know the answer to this. Do you all have peer support too? Because,
Absolutely.
Exactly what you were saying. I think, it's one thing. And I think it's one thing like you and Amy, for example, if you're the only person that she talks to and she feeling like, hey, I can't be the only person you talk to about this.
Yeah.
I think that's so critical. And we know that peer support is so healthy. It is evidence-based to really show improvement in, and I love how you say honor and empower, that kind of support. And then you talked a little bit about care coordination and case management, that you all do some of that through the services that you offer. Now, I know that there's also care coordination and case management that's offered by the VA. So I'm sure you guys walk a fine balance with that.
We do. We work hand in glove with the VA, have great relationships. As with any large federal bureaucracy, there are challenges inherent in the system, but by and large, there are wonderful folks in there trying to take care of our veterans and the caregivers. And we try to develop good, trusting relationships with those both care providers and case managers on the VA side, and leverage them and those resources whenever we can, right? We're not here to supplant what they do. We're here to complement and fill gaps, and sometimes, when necessary, hold accountable or address things that slip through the cracks sometimes. So that's a piece of that. And I want to go back to the peer support piece of this, because that's how I got into this world. When I was a patient at Walter Reed, I was between surgeries, laying in the bed, and this old Vietnam vet in a suit came walking into my room at Walter Reed, and he said, "Hey, do you like milkshakes? Would you like vanilla or chocolate?" And I said, "Vanilla, thanks." And he came back the next day, and the next day, and the next day, and for weeks. And he treated my wife with respect and dignity, and asked how she was doing, and gave us resources when we had questions. He clearly knew the hospital staff there. He was an incredible resource. And I'll never forget, almost 2 weeks into knowing this guy named Jim Mayer, who also is known as the Milkshake Man, I said, "Jim, why are you limping?" He goes, "Oh, my prosthetic's acting up." I said, "Your prosthetic? Jim, you're missing a leg?" He said, "Yeah, I'm actually missing both of them." And I will never forget that moment, because in that moment I went, wow, here's a Vietnam vet who lost both his legs in Vietnam, 40 years on, going to work every day, and after work coming to Walter Reed to do peer visits with newly wounded warriors. And I'm going to be okay. I can't be an infantry officer anymore. I can't do what I was going to do before, but I can do this. I can do something else. And that really started me on this journey. And Jim eventually retired from the VA, came to work for Wounded Warrior Project, and started our peer support program. And so we had it for initially warriors, and then warriors and caregivers. And now we've had cohorts of warriors and caregiver peer support folks, because and we actually certify them, once they're far enough in their journey, they're doing well with their own recovery and are able to give back. As you guys highlighted, there's nothing more powerful than somebody that's been down the same paths.
Absolutely. So in addition to that, I know you guys have a big focus on mental wellness, which is really important, especially with a lot of the people that we've talked to, and physical wellness. You do a lot of that through activities. So can you tell me a little bit about how your veterans, your caregivers get involved in activities with Wounded Warrior?
Yeah, absolutely. So when someone's registered, or they go online and they register, it's wounded, injured, or ill after September 11th. It doesn't have to be a combat injury like mine. In fact, most of our people signing up right now are non-combat injuries. Many of them are under the PACT Act. If you guys are familiar with that, the Toxic Exposure Act that just passed, because of all the cancers we're seeing from burn pits and other exposures in the service. And so people sign up, and they get a newsletter, and it tells them in their geographically specific area. We've got offices all across the country. If you're in Tampa, these are events happening in your area. There may be an art night, night at the opera. There might be a surfing clinic, adaptive surfing clinic, or a adaptive sailing clinic, or you get to go to a Tampa Bay Buccaneers game, or whatever it is, right? Some of this is just about creating a community of peers, and some of it's sort of fun events to get families and warriors together. But the bigger goal is to get them engaged in the more substantive programs and services. So the mental health programs, are Warriors to Work program, helping them find employment, right? And so those are sort of the bringing them in, connecting them with each other and peers in their community, but then tying them into our other resources and programs. And in the mental health front, that has become a major focus. I mean, you guys are well aware of the suicide rate amongst veterans and unfortunately caregivers as well.
Yes.
And so that has been a significant focus. Past few years, we've seen during COVID an uptick in suicides, uptick in substance use. And so we have a whole team called the Complex Case Coordination Team. A good friend, Matt Brady, runs it. He's a retired Medcom Sergeant Major. And we've got a team of basically folks doing social work and nurse case management, but taking really vulnerable folks that are involved in the justice system oftentimes or are on the edge of suicide, pulling them back from the edge and getting them into care immediately. Not 4 weeks from now, not next month, but getting into the care now, VA and DOD care when we can, right? But if not, we will pay for inpatient care and services to get them into the appropriate care. And we'll work through with VA authorizations and all that stuff through the community care network and so on. Because that's hard enough when you're sober, well, and coherent. I mean, I'm sure you guys have fought with healthcare and insurance.
Oh, yeah.
So
absolutely.
Having an advocate who says, okay, I'm going to get you into care. Don't worry about anything else. We'll work all the back end stuff to get the authorizations. And if we can't get the authorizations, then we'll cover it. We will pay for it. And take that fear away from that barrier to care away. And so that team does tremendous work every day, very high touch with a lot of our most vulnerable veterans. We've got our Warrior Care Network, which is a partnership with multiple academic medical centers. And it is world-class PTSD and substance abuse treatment, but a lot of the focus is actually around brain injury. And as you know, the traumatic brain injury is the signature wound of the wars in Iraq and Afghanistan because of all the IEDs. And so concurrent with that is PTSD. And a lot of times the symptoms bleed over. It's hard to know the difference between cognitive deficits and attention issues and anger issues that are from PTSD and those that are from brain injury. So oftentimes we treat those together at those academic medical centers. So that's a program we started some years ago, and it's been incredibly successful. We also have a talk team. I don't know if you've heard of this, but it is non-clinical. It is based on actually an Israeli Defense Force model that was put together years ago of people calling in once a week. And our folks are not clinicians, but they answer the phones. They've been trained to listen empathetically, help with goal setting, and it's a touch point. Every week, a human being that is non-judgmental outside of their circle of chaos with their family, with their spouse, with whatever, that they can just talk to. They can vent to, and unless something is unsafe, manifestly unsafe, it remains confidential, right? It's just this safe place for them to vent, talk through their issues, and have some help with setting goals. It sounds very simple, but has been incredibly impactful, disproportionately impactful, I would say, as far as the resources invested versus the impact for the hundreds of folks that are using it right now.
Yeah. Wow. That there's just like jam-packed, like so many benefits. And so, I think, how do people get connected with you typically? Like if I'm somebody like, I hear about a loved one and I know they're a veteran. And so how do I help them get connected with you to see if there's a service that might be right?
The easiest thing to do would be to call our resource center. It's 1-888-997-2586. We have an entire team of folks there, most of whom are caregivers and veterans themselves, who answer the phones 8 a.m. to 8 p.m. every day. And they will talk you through what are your needs, right? Are you homeless? Do you have acute financial needs? Is your husband becoming more and more volatile and angry and you don't know what to do and you're just reaching out for help? And they'll talk through all the options of programs we can provide and the programs some of our partner organizations can provide as well. They have a thing called the INR database. So not only is it our set of programs and services, but our partners and VA and DoD programs, and it's constantly vetted, right? We're always making sure that we're not sending someone to a dead end, right? If you're saying you need help with repairing your house.
Right.
And maybe we've already helped you with emergency financial assistance before, and we're not going to be able to do that right now. We'll turn you to a partner and do a warm handoff with that partner. But we know that those people are funded. They're actually providing scholarships or grants at this point.
Yeah.
If you go to some of the larger databases out there, there's 1,000 resources, and you don't know which is good, which is bad, which actually
Right.
are going to provide funds or counseling, and which are not. And so the team does a good job of keeping that up to date, making sure that trusted partners we're making referrals to. But usually we'll make referrals internally, right? And it's the whole spectrum. It's, you know, everything from getting to climb Mount Kilimanjaro to I just need something to turn the lights on today.
Yeah.
My utilities haven't been paid. My kids, we don't have air conditioning. It's in Florida. And we'll pay those utilities. We don't usually advertise that broadly because our emergency financial assistance team is small, but it is something that is a stopgap. And in my opinion, everything has failed when we have to use EFA,
Yeah.
right? It's a bandage on a sucking chest wound. Now we have to peel the onion back and figure out, why did we get here? How did we get here? And then we bring in the mental health, the substance abuse, our Warriors to Work team, to help make sure that doesn't happen again.
Yeah. So I have a question, Jonathan.
Yeah.
I'm a civilian, but how can I help? I see donations, but what other things can I do as a civilian?
It's a good question. Now, we do have some volunteer opportunities through our website at woundedwarriorproject.org. And, you know, more broadly, I would say if you know a veteran in your family or in your community, you know, thank them for their service. If you know a caregiver, and you guys know this, see how you can help. Be a friend, be a listening ear. I mean, honestly, just having someone listen to them is oftentimes one of the biggest helps. And I've gotten very unwarranted kudos over the years for just sitting on the phone and listening to somebody for an hour. And that can be tremendously impactful. So just be a friend, be an ally, and maybe know some resources, you know, and keep the Wounded Warrior Project Resource Center number. So if you don't know what to do and a friend says, my husband's struggling with drinking and I don't know what to do, say, here's a number. Have them call the Resource Center. And they will hand walk them through the process into an appropriate substance abuse program. And we won't turn them loose until there's support or resolution.
You know, I love that. And I think that dovetails in where you were saying, you know, people thank me for listening. That listening, though, gives you the ammunition that you need to be an advocate, because I know that you're a fierce advocate. You know, you had mentioned getting to testify in front of Congress, advocating for positive change to support veterans and their families. So tell me a little bit more about that.
Yeah, absolutely. It's one of my, I guess, proudest things is being able to impact some federal policies at the VA central office level, on the DoD side. We have an entire government and community relations team in DC that works closely with Congress and the Senate and senior leaders in VA and DoD to make sure that the things that we've learned over the past 20 years of, 20 years plus of combat operations, we don't lose those sharp edges of things we've learned about how to care for warriors and caregivers, about how we don't drop balls between the VA and the DoD during that transition process, about support for caregivers. We created and sponsored the landmark caregiver legislation years ago to provide support for our caregivers, both training and fiscal support when they quit their jobs and it becomes their full-time job caring for a loved one who's been severely injured. That was one of ours. The traumatic service member group life insurance was one of our first pieces of legislation that didn't exist beforehand. And what we were finding is we had young privates coming back from war missing 3 limbs, and their houses were getting foreclosed on. They were losing their trucks because they didn't have the money. There were gaps in pay as they were transitioning out of their command downrange. And so TSGLI was just $100,000 big bandage, but hey, you've been critically wounded. Let's give your family enough money to get through these next couple of years without worrying about the financial impact. And we've been involved in dozens and dozens of significant pieces of legislation that have directly impacted our warriors and caregivers. And oftentimes, it's not even a significant piece of legislation. It's just letting somebody at VA central office know, hey, we're seeing this in Little Rock and in Long Beach and in Brooklyn. You guys should probably be aware of this. Because usually, a lot of times, it's not from lack of attention or lack of caring. They're not aware that the issue is arising.
Yeah.
And when they're made aware, they can address it without us having to go through legislation or those kinds of things. Because as I said before, most of the folks in the VA are phenomenal human beings that are trying to care for warriors and their families. Yeah. They just need to know what the problem is.
Yeah.
I love that.
Sometimes we have to hold them accountable too, right?
Well, you know what? I mean, here's the thing. We all wear the No Perfect People t-shirts. Yep. And I've worked for government myself. And so we all know it's hard to have such a beast of a system and for it to, it doesn't matter whether it's healthcare. I've 25 years in the healthcare system. Yep. Trust me, we have the folks that are like, you always hope that you get the right person who is like bend over backwards. And whether it's that in the mental health system, or we've worked with our mom and trying to support her as she has Parkinson's, it's the same thing. And so I think it's the biggest thing is what I keep hearing is we're here to support you. We want to advocate for you. If you feel like you get stuck, how can we help you get unstuck? And, whether it's us or we have a wealth of partners that through our information and referral that we can also connect you with there. So you're trying to be a no wrong door.
That's right. Yeah. That is absolutely part of our ethos is there is no wrong door. If you come to an adaptive sports clinic, you're doing sled hockey, and you complain about not being able to get new stoma bags for your colostomy, what should happen is somebody on the team should go, okay, well, I don't know a lot about authorization for durable medical equipment, but I know a person on our team that does. Right. And he'll know the right person at VA to call to get that authorization or to get an answer about why this isn't happening. And so that's critical to some of the goodness, I think, is that wherever we find them, whether it's hospital bedside or out in an event in the community, that ability to identify what's going on and then get them to the right teammate. It's a wonderful part of having, we've got about 900 employees across the country from diverse backgrounds, all across the country, many veterans and caregivers in those numbers, but a diverse bunch of experience. And like with you all, some of them are not military caregivers, but caregivers who see what we're doing and see the impact on both veterans and their caregivers, and have joined us in providing support and care through our independence program and our complex case coordination programs.
I love it. Now, I will tell you, I have to say that I have a favorite so my husband and I ride Harleys.
Yeah.
And we know that Harley Davidsons, and Harley, if you'd like to sponsor us, you can, but Harley Davidsons are synonymous with the military. Yeah. And that's something I absolutely love. And I know that Harley Davidson supports you guys with when you purchase from them. So, and I know you've got some other partners, but that's just something that I just wanted to be like, I love that because we have street glides. And so I'm like, oh, that's good to know, because that way, when we're intentional about our purchases, like as consumers, we're like, that's another way that we as civilians can give back and say, hey, I support. And I know that if I purchase that, I know a percentage of the monies goes back, and it's like carrying forward.
Absolutely. Yeah. Thanks for highlighting that. Yeah. My good friend, John Roberts, started our rolling Project Odyssey years ago. Project Odyssey is sort of this experiential education thing for folks struggling with PTSD, mental health conditions. We have them for warriors and for caregivers, but we take them out of their comfort zone, put them with other warriors who have been through similar things or struggling with mental health issues, and then do something used to be, camping, river rafting, rock climbing, horseback riding. And then John's like, he's an old Harley rider, and he was actually with our founder, John Melia, in Somalia when his helicopter went down years ago. And John was horrifically burned and became a peer mentor and ran our benefits program for a while. But John actually came back and started this rolling Project Odyssey with Harley Davidson. And So instead of riding horses, they're riding Harleys. And
love it. Count me in on that one every time.
That's awesome.
Tremendously impactful. And those relationships forged during those Project Odysseys have lasted and lasted. And more importantly, when they're there, they're going, wait, you're doing that too? You struggle with that? Your doctor said that too? Maybe I should try that, right? And destigmatizing both treatment and, ownership of the stuff they're going through. So,
yeah. Jonathan, I can only say and tell our listeners, there's so much information that you've provided for us, but your website has so much information as well, because in addition to Harley, there are a lot of vendors out there that if you purchase through them, they give a donation back to Wounded Warrior, which is fantastic. That's an easy way for anyone to get donations back to support the cause. Everybody can participate. But I will say thank you for being here with us. I will say thank you for your service. That never feels strong enough. So just that I'm grateful for all that you have done for our country, but for us. But we are so thankful that you've been here with us to share.
Yeah. Well, thank you both for what you're doing. I mean that sincerely. This is important, and for highlighting some of our families who have sacrificed and done 100 times what I'll ever sacrifice or do in their time. So thank you for that. It means the world to me, because these, as you know, our military and veteran caregivers are the unsung heroes that nobody sees, that put in millions of, thankless, unpaid hours doing really hard work with people they love. So I can't thank you both enough for this.
Absolutely. Well, everybody, we will have all the information about Wounded Warrior Project. We will have all kinds of good stuff on our website in the show notes, and we'll be posting it throughout the month, but it'll be permanently on our website. And then, of course, you can go to the website with Wounded Warrior. We'll make sure you all have that link. Jonathan, thank you so much for being here with us today.
Thank you.
And all right, guys, until we confess again, thanks.
Bye-bye.